The number of measles cases reported in the U.S. this year has reached a 20-year high. 288 cases of measles have been reported to the CDC through May 23rd, and that number is still going up. Mary Wisinski with the Kent County Health Department joining us tonight to explain why we're seeing those numbers jump. Mary, thanks for coming in tonight. The CDC says 90% of these cases are folks that have not been vaccinated. What's going on? Why?
Many people are choosing to forego immunizations because of philosophical objections. And while measles was eliminated in the United States in 2000, we still have many places in the world where measles is a big problem. There's a huge outbreak in the Philippines right now. There's been outbreaks in the last few years in Europe and in Africa and Asia. And so what happens is these people travel outside the United States and then they bring the disease back.
You know, we hear an argument too. There is philosophical reasons, there is religious reasons. Some people think that vaccinations are tied to autism. I think that's been debunked by the medical community. Why does science have a hard time trumping superstition?
I believe science has a hard time because if I want to be an informed parent, I might go on a website and look for immunization information. Unfortunately, some of the first sources that come up are not valid sources of immunization information. We also have people who are movie stars and who are in the public eye, sort of perpetuating those myths that science has disproven. So I think we need to do a better job at telling our story, that the MMR vaccine, measles, mumps, rubella, is a safe, effective vaccine. It does not cause autism. Yep. And measles can have serious complications.
I was going to say, tell us that you get measles and that's not a picnic in the
No,
park.
it's not a picnic. And although many people do very well, they can have a high fever, rash, runny nose, a cough. Children can get ear infections, pneumonia. In other countries, people are dying from the measles. So it's still a serious disease, and in the United States, although it's been eliminated, we need to be concerned because of all the importation from travelers who are leaving the United States and don't get their vaccinations.
They're not vaccinated, they go overseas, they come back, they have it, they catch it overseas.
Correct. And measles,
that can be prevented.
Yes, and measles is so highly contagious that 90% of the people who are exposed and not immune do get the measles. So sometimes doctors who haven't seen it in years, we haven't had it, they don't recognize it immediately.
Sure.
So if they're not isolated, then they infect that many more people while they're waiting to be diagnosed.
And you mentioned too, in Kent County, clean bill of health, we're not seeing a spike here.
We are not seeing a spike here in Kent County. In fact, of our 19 to 35 months old in Kent County, 82% of the kids are up to date. So we're working very hard to raise that number. We want to get 100% of the kids vaccinated.
That's right. Let's stay healthy, that's for sure. Mary Wisinski, thanks for coming in tonight. We appreciate your insight.
You're welcome.